Hey guys, welcome again to Luna Unscripted, where we talk about real life, real career paths, clinical insights, and just the nitty-gritty details of life as a PT. I'm Katie Wiley, one of your hosts.
And I'm Joe Valdez.
I'm Marcy Arenas.
All right, welcome back, guys. It's a beautiful Thursday here. How's everybody's week been?
It's been Joe and I are only 300 miles apart, so we can see what the weather difference is. But here in Houston, it's been stormy, rainy, and humid.
Same. Yeah, we had some lightning the other day. I think it was yesterday. A little bit crazy. So my grass is happy, but I'm ready for some warmer weather.
Or like
Yes, I don't
thunderstorms
mind
and
rain.
lightning? Is that like unusual for you
Yes.
guys in Texas? Like to have like a thunderstorm or
No,
like
we get bad
lightning? Okay.
storms, and May
Yeah.
tends to be like the bad. That a couple of 2 years ago, we had this thing called a derecho. It's like straight line winds that knocked over a bunch of stuff. So May seems to be bad weather time, and I don't mind bad weather, but like not at 2 a.m. because then my children want
Yeah.
to crawl in bed with me. And then I already have
Mhm.
two giant dogs in my bed, and so then I sleep like this, and then I don't sleep. That was
Yeah.
2 nights ago. So then
Yeah.
I'm dragging the next day.
Yeah. Understood. It's been definitely rainy in Ohio too, and it rained like all day yesterday. And last night I went to the Bruno Mars concert and it just like held off for like a couple of hours. No thundering, no lightning. It was beautiful. It was super fun. He was amazing. I highly recommend. Very good
I
one.
do. I love his dancing.
Oh,
So
he's so good. And he like sold out Ohio State Stadium, which is just gigantic. And it was just, yeah, it was an awesome show. So 10 out of 10, recommend. Do it.
so you're running on less sleep today.
Less sleep today, but you know what? I'm still excited because we have a very wonderful episode ahead. I'm very excited about. We're going to call it Therapy Sessions Gone Sideways. And this, we are going to talk about funny things that happen in the world of physical therapy. There's a lot of them, funny stories, funny patient situations, just things we encounter that you're like, just didn't anticipate as being part of our profession. But it keeps our days lighter and gives us some funny memories and funny stories. So I thought we would get into that a little bit here today. So I figured we could start off with things with patients, funny stories that have maybe happened in the clinic. Joe, do you have any good ones?
I do. So my first rotation was in acute care, which I mentioned in previous podcasts. I'm an ortho guy, outpatient guy, but I figured, I'm going to broaden my experience and do something in acute care. Well, the CI they matched me with was in the ICU. So it was like acute care, like the most acute you could be. And it was a learning experience. It was a lot of fun, but patients are very high complex. You never knew what you're going to get in that setting or in that unit. But I got to a point where my CI was very trusting of me and she let me kind of handle my own cases and she would just sit in the hallway and document. I did have a patient who had dementia and was my first real dementia patient, which if you work with them before, you never know what you're going to get. Um, and our goal was to get her out in the hallway and do like a little loop around the ICU unit. That was our goal for that day. And in the hospital, most of them just have gowns. They don't really have anything underneath the gowns. So she was just fully commando under the gown. Tried to help her, cinch it up better, but she was not wanting to, just, dementia. Anyways, we get out in the hallway. We start to walk around. We're having like some light conversation. And then she just stops and looks in. She goes, "What are we doing?" I'm like, we're going walking around the unit. She's like, "I think I forgot something." I was like, "What did you forget?" "There's nothing in your room. We can peek, but we'll keep going and we'll come back and we'll report later." Anyways, we start walking. Next step, splat. I just stepped in a pile of poop. She had
Oh,
taken a dump in the hallway, very wet, very runny. I don't know how I didn't notice, but this giant turd I stepped in, brand new shoes, my Nikes, and I was like, "Oh crap," literally. So I'm freaking out. My CI is nowhere in sight because she's like next hallway over doing notes. And so I'm just like, all right, we got to sit down. So we kind of backtracked. I found a chair, pulled it over, sat her down, got her safe. And then I walked down to the hallway, grabbed some wipes to start cleaning up my shoes. And while I was doing that, the whole medical team in the ICU was rounding. So the physicians, the interns, the pharmacists, the nurses, nutritionists were all right there watching me clean this giant, you know, crap, off of my shoe. And they started to like giggle and laugh. And I was a student, first rotation, it's pretty embarrassing. And that's when I decided I did not want to be in the ICU as an actual physical therapist.
Oh, yeah.
Um,
Yep. That's a good one. That's a solid memory on one of those
That
oh,
is a
rotations.
it's a core
solid,
memory.
or
I still
actually, I guess for
remember
you, it wasn't that solid.
yeah, all the eyes, like 10 eyes staring at me while I was cleaning it up. Yeah. My
Yeah.
CI wasn't there to back me up either. She had to go solo. So
Oh,
that's yeah, that's
man.
my probably my most memorable experience as a student on my rotations.
Yeah. I can see that. Yeah. All right, Marcy, give us a good one. What's another good in a
Um,
clinic or in hospital or inpatient care
okay.
story?
Yeah, so I have a couple. I'll go with, I have ones on similar lines of him, but I'm gonna go, so when I was in inpatient rehab, this is with pediatric patients. And so we would see patients post like motor vehicle accidents,
Mm.
traumatic brain injuries, things like that on any like Rancho level, generally right after minimally conscious. So they're progressing through the Rancho levels. I had one early teenage boy, um, and uh, he was in a golf cart accident, like was driving the golf cart too fast, rolled over. Anyway, had a hemicraniotomy, had part of his skull removed, swelling, all of that. So he came to us once he was right out of the minimally conscious state to start kind of working on rehab. Um, and for anyone that doesn't know, when you're like transitioning through the stages, you get into like a fight angry kind of stage, and then you get into a stage where you just kind of like things you have no frontal lobe, no inhibition, things just you just say them. And it was probably my first, I mean, because I'd worked with littler kids, but I don't really say much. With the tween, and like boys have foul mouths, and he would say just whatever came to his mind out loud. And his poor mom, he would say things like, my mom fondles my dad's blank, and all kinds of things like that in the middle of a gym while we're walking
Oh
out
my
loud.
gosh.
And I'd be like,
You're telling all the
oh
other
no,
kids like earmuffs, earmuffs, cover
earmuffs.
them.
His poor mom is like bright red, and she's like, "Oh my god, my boy would never say things like that." And I had to explain to her like, "This is it's normal," but like trying not to laugh at him while he's saying things like that, it was challenging. But very memorable in terms of everyone still kind of talks about him and all the random things he would say about, teenage boy things that came out loud.
Oh man. Yeah. Yeah. I could see that. Like, no, yeah, no inhibitions, just that stream of consciousness. Yeah. I've definitely had like I've worked in areas where there was a dementia memory care like unit, and yeah, there's definitely that lack of inhibition again, and just that different processing. So where people would almost like, because some of our geriatric male patients, they're like, wait, you're seeing that patient now? I thought you were my physical therapist. Well, I'm like, I'm all of your physical therapist. And just like them understanding like that, I've definitely had that side of things too. Um, all right. So I gotta talk about that low hanging fruit of comedy, farting during therapy
Mm.
sessions. Like it's just, I can't tell you how many patients have passed gas during their therapy sessions. And it's so normal, right? I mean, we're moving, we're getting that GI motility going. So, but it is very common. And there's two types of patients that I found, the ones that acknowledge it and say, "Oh, I'm so sorry." And then the ones that like ignore that they did it, even if it's like multiple times during it. Um, I found I prefer the ones who acknowledge it because at least you can be like, "Oh, it's so fine." And then if you like step away for a second, 'cause sometimes you have to step away. If you're like standing right next to them at the treatment table, it can be a little like, gotta kind of like
Mhm.
take a breath, get some fresh air. Um, I will never forget one of my clinical rotations. I had this gentleman, we were working on repeated like sit to stand transfers and kind of going back and forth a little bit, pivoting around. And he just would not, it did not stop. Like he just kept going. And then there was one where he's like, man, that one was really a stinker. And I just, when you're in a clinical, you're trying to be so professional and you're like, I can be a PT. And I just could not stop laughing because it was just, so well timed and it really was a stinker. And yeah, yep. My kids find this very funny that farting happens as a part of physical therapy. Like I've mentioned it before. They're like, wait, people fart when I'm like, oh yeah, it just happens. And I don't think I ever like thought about that going into the field. And again, it makes so much
Oh,
sense,
no.
but yep, it's
Yeah, no,
definitely
the nurses the nurses in inpatient rehab would like if someone was backed up, they'd be excited on like Mondays when PT would come on. They'd be like, "Oh, they're gonna get them going
things are
again,"
gonna happen
and things like
today.
that. So yeah, I definitely so Joe stepped in poop. I have been pooped on.
Oh,
So
yeah.
at least not by an adult, right? Things are always slightly better when it's a child than an adult. Um, but same thing. It was like a 2-year old who was in a non-accidental trauma. We're covering inpatient rehab. They're laying down most of the time for safety purposes, especially when nursing's around. So I got them up. We were working on standing and kind of just like weight shifting. Motility happened, and it was just like you heard bubbling in the noise, and then it came out of the diaper and then all into my scrubs. And
Oh.
so I
Who's
had learned from
preparing
that
you for
moment that you always
parenthood,
take
right?
care. Yes. Which
Exactly.
is better
Yep.
when it's your own kids. But yeah,
Is it though? I don't.
I get a
Oh,
little bit,
it's so
tough when
gross.
it's my own kids, yeah, than someone
Yeah.
else's. But like, you can't. I mean, it's a 2-year old, so they don't really care. But I didn't want to be like, ew, gross. You can't just throw them somewhere, right? They are basically dependent, so you have to like figure out how to like stand up, try it, like get nurse to come help clean them off while like not, I guess, dropping poop everywhere because it was pretty liquidy.
Yeah.
So yeah, so I always had extra scrubs in my bag after that.
So smart. You never know. Yeah. You never know.
Katie, your
Uh,
story reminded me of this reel that I've seen, and it's been recreated a bunch, but it's like it's for PTs, right? And this PT is stretching out this patient on the table, and someone passes gas. You hear this like audible like fart, and then the PT is like, "Don't worry, it's perfectly natural." Trying to calm the patient down. The patient's like, "That was you." He's like I said, perfectly natural. That's what it reminded me of that story. That was pretty
exactly.
funny.
I've never had anybody go on that side of things, but just like the ignoring that it happened. It's always like either the roll over on the table, right? Like that, or like getting up. Like it's one of those two.
Or
You're just,
doing a bridge. I've had people doing it while like
oh,
doing a bridge.
oh, yeah.
They're doing
So,
that Valsalva maneuver and just pushes it out, you know?
yep.
Just checking.
Hey, great part of PT, part of the added benefit they didn't even know they needed from PT. So, yeah. Well, how about do we have stories about like dumb things that you've done that you're like, oh my gosh, I can't believe like I did that in the clinic or like little mishaps or things like that, kind of funny on that side of things? I know I definitely have one.
I've got a really dumb thing that I said to a patient who was dealing with cancer. So I was a lymphedema therapist at one point, and this guy was going through chemo rounds. I was working with him, and so he's bald. And at this common phrase I say to people when like we're about to wrap, I was like, "I'm gonna get out of your hair now." And at the very end of the session, I was like, "All right, sir, I got to get out of your hair now." And we gotta wrap up the session. And he like looked at me. He's like, this bald guy with cancer is like, I don't have any hair. I was like, oh crap, you don't have hair. I'm just joking. So it was a little bit embarrassing there. But
Oh,
and there's many times I've said something that's just really dumb to patients where, in the end they didn't respond, they didn't laugh it off, and I just kind of had to deal with the embarrassment. So
yeah. What about you, Marcy? Any good ones? Just of like, oh my gosh, that was so dumb of me to have done or said or
Um, I think I've said so many dumb things that they all kind of blend in my mind where you're like, frequently.
Mhm.
There were a couple times that I would staff our sports med clinic and see the patients before the sports med doctor would come in. Kind of then we would discuss the plan. There was one time I definitely told someone that she was going to need surgery before this physician had ever said anything to her about it. And I started talking about the recovery part of it, not even like, hey, you're gonna need surgery. I was like, okay, so after surgery, blah 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 blah. And she like looked at me horrified and started crying, and I was like, ah. And she was like, I didn't know I need surgery. And I was like, how can I fade into the wall right now? And so trying to uh, overcome that, which she became a patient of mine. And then when she was like graduating, her and her mom were both like, we really didn't like you at the beginning because you told her she needed surgery before like she even knew from the physician and things like that. And she was really scared. But now we really love you. And I was like, okay, glad that it full circled. But yeah,
See, you
so
rebounded, you
that's my
recovered
story.
from it. Good work. Yeah, you
It's
can
one way
come
to
back.
break the news, right? Just throw her in the water.
Yeah.
How about you,
Seniors.
Katie?
So mine is not as much something I said, but like, when you're in like this is from a busy clinic setting, how you're like juggling multiple like conversations, getting something ready for the next patient, like that kind of thing all at once. So I had a patient like on a piece of equipment, had a patient on one, we had like two treatment tables that were ours dedicated. So one of my patients was on one of the treatment tables, and then I had a high-low table that I was, nobody was on it. I was getting ready for my other patient who was going to come over, and we were going to do, some exercise over there. So I was getting things adjusted, and I started lowering the table. I think we were going to do like table squats or something to it. And I started lowering it, not watching the table at all. And I was talking to the patient, keeping an eye on my other patient, had a foot on the pedal. Little did I recall that there was a stability ball like wedged underneath the table, which I would sometimes put there so it didn't like roll away. And I definitely lowered it to the point where it popped, said stability ball. And everybody in the clinic's like, what just happened? I'm like, I'm so sorry. Like, thankfully, nobody was around, nobody was hurt or anything like that. But it was one of those, I'm like, I can't believe that I just did that and that just happened. And thankfully, we had an extra ball in the clinic, so we could still use one. But I felt so dumb. And it was one, I was like, oh my gosh, this is so embarrassing. But I'm going to chalk it up to a product of the multiple layers of juggling and the challenges
Yep.
of having more than one patient at the same time.
Oh
But
yeah.
yeah,
It's the same. It's like similar to you start treating the wrong side of the patient and then you're like, oh, I'm just assessing this side compared to the other side.
yep, I've
For
done
like
that
20
before.
points.
Really just
Cool. The
checking things
stable
out.
PT. Yeah, that's for anyone that does that in the future. That's your line. You just say, "Oh, it's just comparing to this side."
Right. Like with the shoulder range of motion, like, like a post-op shoulder, I've had that. And then you have them lay down and it's like at a different angle than you're used to. And then you're like, wait, yep, this side, yeah, just checking, checking.
Yeah. hmm
Yep.
hmm
Definitely done that before too. Um, okay. So what other funny stories? How about like with like coworkers or doctors that we've worked with? Any good ones related to those interpersonal coworker interactions?
The
I think
the
Marcy's got
same
one.
the same sports med doctor that I worked with was really handsome. So we all had like running jokes in the PT department, a bunch of, 30 or well, 20 and 30-year-old women. So we all, it's like McDreamy, right, from Grey's Anatomy. And so I would joke with the nurses in the clinic. I was like, he's mine. Like, you guys stay away. He's mine. No, he's 40 and married and stuff like that. So one time, and he worked at a different hospital, he would pro bono come to Shriners. And so one time I was calling the clinic to be like, hey, his clinic started. Is he there yet or whatever? And I called and I said, hey, is my man there yet? And I was on speakerphone and they were like, uh, yes, doctor just walked in. And so he heard.
Oh. Did he
So luckily
acknowledge it at all, or did he just kind of ignore that
he kind of
you ever
ignored
said it?
that. I like
Okay.
then started to like after that put in like funny like work husband joke type things. But yeah, no, I the nurses never let me live that down. They would still laugh about it like weeks later. So it was definitely one of those when I came down the stairs to go to clinic, like, okay, let's not make eye contact.
We've definitely had, so like I worked in some practices with physicians, they're a big part of the orthopedic practice and the surgery. And there's been a couple that patients will be like, did you see that doctor? Like he's just so handsome. Like these, more geriatric little ladies coming in and they're enjoying every piece of that doctor's appointment that they had. Definitely.
Uh-huh.
Yeah.
Hmm.
Mhm. All right, Joe, what you got? You have any good ones?
No, I mean, I feel like coworkers are what made PT bearable throughout the day,
Mhm.
right? Because,
Yeah.
when things are crazy, they're the ones that you can kind of lean back on or talk about. I can't think of like a specific example right now, but I do remember me and a coworker, it was right before lunchtime. I had a patient who I was wrapping up with, and he loved having the ice pack, the big cold pack on his shoulder. Felt good, just 5 minutes, and then he'd go home, right? And so I put the ice pack on him. My coach starts talking about lunch. She goes in the back to get her lunch. I get hungry, so I'm like, all right, I'm gonna sneak back here, get a little bite, and then come back, get the ice pack off this guy. Then we just start chatting. We start talking about the day and kind of like how things were going. And I completely forgot about this guy with the ice pack who was by himself in the clinic. And we were out for an hour. We were back there for an hour talking about stuff just because we're good friends. And then I was like, oh crap, my patient is still out there with an ice pack. I was like, he must have gone home. Like there's no way he sat through all that. I walk out there and he's still there sitting in the same chair with the ice pack just like drenched because it was not cold anymore. And I was like, dude, you could have gone home, right? He's like, oh, I thought you wanted me to stay here and like have this ice pack on my shoulder. I'm like, it's been an hour, go home. And so, not directly coworker related, but my coworker did distract me from the fact that I left my patient sitting down the ice pack for over an hour. And he was a compliant patient. He stayed there the whole time.
Was ready. He wanted to really soak in all of that goodness.
Yeah. Yeah,
Yep.
definitely past point. Yeah.
Yeah. I was trying to think too. There was nothing like overtly like a specific situation with my coworkers or doctors. We did in the clinic I was in, had a good, rapport, and we really got into Halloween. So we've done like lots of fun Halloween costumes like collectively in the clinic. Some of them we did not plan or think through like what a day of treating for like 12 hours in the clinic would be like with that. So I think my first year there, we were like Minions and Gru. So one of my coworkers was Gru, and then we were Minions. So we had like these yellow hoodie sweatshirts and jeans, and then we had these like goggles, and then we put like things in. They were like like the lab type of goggles. So we put paper in them, so it looked more of like a Minion. And you cannot treat in goggles, just for future reference like that. Like it's just like trying to talk and have a conversation with a patient at a table with that on. So by the end of the day, it just looked like we were like in hoodies and like jeans and like they were like, what? Because nobody's keeping there. You're like sweating through it by the end of the day. We got a cute picture with it, but that logistically was not the best kind of thought and functioning throughout the day. Same with we did breakfast club one year. So I was Molly Ringwald, and so I had like a red wig, and just found I don't love wigs for like just general or especially Halloween type of wigs. Because yeah, by the end of the day, they're like, wait, who are you? And I'm like, just pretend like my hair is red, and then you'll get the idea of it. We had a good picture. The picture was really what submitted us into the contest. Um, the one we won for, we did. Have you seen the Halloween costumes where it looks like you're on a roller coaster? So you can like kind of
No.
rig up cardboard boxes and like put a pool noodle through it. So you kind of put it over your head and you stand like all in a line and it like looks like you kind of stagger it up like you're on a roller coaster. So we did that and that one got a good picture and that one did. That
That's
came
really cool. Yeah.
that came through with the
Yes, you guys got
victory.
creative with your costumes.
Yeah, that was
Yeah.
something we definitely got into. Could not treat in that, obviously. So we basically just during the day had like Disney type shirts on and ears and stuff like that. So at least it had like kind of a cute theme. But the boxes were not treating worthy from a costume standpoint. But we did have some fun with that. That was a good one. Yeah.
Yeah, we did
Um,
Halloween too.
yeah. Any good costumes?
Yeah, I mean, you work at a children's hospital, you have to do Halloween. I will
Oh,
say, of all
yeah.
the departments, though, the rehab department was the least, I don't think we were the least creative, right? But I do think that we were the least participatory because we're like, hey, well, we actually could treat the patients. They would do like a little parade where they would go through the different departments. And so departments that
Oh,
didn't like medical records and other places that didn't have to treat them, like really went all out.
yeah.
And I think our first year we like that we really did it. We did go all out and then we realized we couldn't treat like that. So we became smarter with our costumes after that. They were basically
Mhm.
like t-shirt type things, but we would decorate the halls more. My favorite one was we did book like kit children book covers.
Oh,
And
cute.
so me and some of the OTs did the very hungry caterpillar. And I was like 8.5 months pregnant at this point. And so I was the front. And so they put the face on my belly. And so I had the eyes and the mouth on my belly, and then they all just kind of like lined up behind me. And so we were the very hungry caterpillar for like a hot moment, and then we went to treat.
That's super cute. I love that. It's good. All
I think
right. Oh,
the
go ahead.
creative costumes with it when you're pregnant are hilarious. I love the creativity of that.
Yeah. Great. Have you guys had situations where you encounter patients like in the wild, so like not in the clinic, not in the hospital? This is definitely something that happens to me where I treated, in the same town for the past 13 years. So I definitely run into people. Do you guys find this too?
Yeah, yeah, for sure. I mean, I feel like there's two different groups. There's like the group that is like super excited to see you, be like, oh, there's Joe. He fixed me. Hey, this is the guy that fixed me. And it feels really good. And then there's a group that like you don't want to walk up to them because you don't want to like break HIPAA stuff. But they obviously know you're there and they're just kind of ignoring you. So in those situations, I don't really know what to do. But yeah, I do run into that sometimes.
Yeah. I feel
I did
like,
not.
go ahead. Go ahead,
I
Marcy.
did, don't really run into patients. I mean, I worked for 10 years in a hospital, and so most of them weren't local, but I did happen to run into like surgeons and chief of staff of our hospital a couple times at like the grocery store, and that's like the opposite. So I'm like, uh, do I pretend let me just go a different direction, or do I say hi, or what? Because then it's like, as the chief of staff, it's kind of like, I know you kind of know who I am, but do you know my name? Like, so I'm just like, all right, I'm moving on.
Yeah, no, it's definitely one of those like it's nice because some of these patients you spent like months with, like multiple times a week. I sometimes have trouble remembering names. That is my only like qualm with it. Oddly, I can usually remember the body part. So like I'll remember if I stretch your shoulder out twice a week for 3 months, I'll be like, how's the shoulder? So at least there's like that. Like I can remember that. Sometimes I'll remember their name, but like, and then sometimes you're like, especially because I worked in a high volume practice for a while, like I told you guys, so think of how many patients you see every day and every week, like day in, day out, it's just a lot. So just that memory side of things, that's my only, I'm like, hey, you, like, how's it going? I feel bad about that because, I feel bad not remembering their name, but at least I can usually get the body part. And it is always awkward, like from a HIPAA standpoint, because like if I'm with my family and then the patient pulls me over, I'm like, I can't like introduce you, but I guess I can be like, this is my husband, my husband's name's Eric. This is my husband, Eric, and then they'll, I guess, introduce themselves if they want to. That's usually my approach if I'm like out with the family. But it's always like, how do I navigate this? So, yeah, but it happens. It's nice, nice to be a part of the community and be a positive impact on
Yeah.
people. But just the all of the logistics of that. Okay, how about we wrap with I feel like one funny thing that often comes up are patients wanting to come up with their own like abbreviations for PT or different ways to like nickname us as their clinicians that are not physical therapists. Do you guys have any good ones or names that your patients have kind of called you or dubbed you or anything like that?
I want to hear Joe's.
I mean, I don't have one that's super creative. I think I got like physical terrorist a lot.
Mm-hmm.
I think I got Joe the Destroyer one time from an
All
older
right.
patient.
Ooh,
That's a
That was
solid
kind of
one. I
like,
like
you
that.
know, something you feel like a little masculine, a little strong, you know, feel tough, but I don't think they meant it in like a nice way. I think they meant it as like a Joe tortures me kind of way. But yeah, physical terrorist is probably the biggest one I heard, which I feel like is a pretty common one.
Yep.
hmm
What about you,
Yeah,
Marcy?
physical, torturous, physical, yeah, torture, terror, all that kind of stuff. No, my nickname pretty much across the board was like Sergeant. I was very much like, we're doing it and I don't really care what you say part. That's kind of my mentality with it. And so it
Mhm.
was always like, oh, the sergeant's in town. Oh, she's here. Um, so I like to carry that part. And inpatient rehab, there's no like, you can't say no. We have to get our minutes in. So I've carried that into acute care and into outpatient. Like when patients, especially like with kids, you can be like, you're doing it. I don't care. With the older people, I had to kind of like find a more of a sweet spot because they had like think they can say no. And then I'm like, oh, I'm talking to an elder. But then I had to get over that. I was like, you're going to do it because it's going to be good for you. So get up.
Yep. And
And
sometimes
they're
they
like,
need
yes,
that little
sergeant.
nudge, right? They just don't
Exactly.
know how important it is. Yep, I agree. Definitely physical terrorist has been there. PT standing for pain and torture. That was a common one that I heard too. I had a patient who had like just a tough recovery from a knee replacement. So, you're having to really work heavily on that range of motion, and it's obviously not the most comfortable thing. So when she like wrapped for her plan of care, she got me a mug that said Queen of Pain. And on the backside it said, "Don't mess with me. I get paid to hurt people." I was like, well, I'm like, hopefully she came out with a positive experience. She did well, I mean, long term, but I was like, all right, I still have it. Queen of Pain mug. Had a nice little crown on it.
Yes, own that. Yeah, you own that. I'd take that
Yep.
place. I put on a shirt. Don't mess with
Yep.
me.
We made it through. So Queen of Pain. Look at that title. But all right. Yeah. So PT is just, it's a wonderful profession. And then, yeah, sometimes things just happen and funny things and definitely good
Yeah,
memories.
you gotta laugh at things. You gotta take it the light side just because when you are in a high volume clinic or you're in a very serious kind of setting, even potentially like inpatient rehab, like it can really get to you. And if you don't have a way of taking either making something light of something that happened during the day or not taking it home with you can really affect you mentally and emotionally.
Yeah, I 100% agree. And yeah, just soak in those. I feel like as a PT, we often are a little bit like, we're a physical therapist, but we have a little component of that therapist component too. So loving on those patient conversations and getting to hear their funny life stories and their specific situations, I feel like, makes our job even more rewarding and really builds that good rapport. And obviously we get some great things to laugh at, just along the way with the silly things that happen. So, well, awesome. Any last thoughts, you guys, or any last funny
No, but
ones?
I want to hear from everyone else. So if anyone has a funny story, send it on into
Yes.
us. We'll put it on air. We want to hear it.
Yes. Please share. We can definitely read them off next time, recruit other people's funny stories and ideas. I'm sure there's some awesome ones out there. All right, perfect. Well, thanks for stopping in this time with Luna Unscripted, and we look forward to seeing you next time around. Have a great week.
Thank you for listening to Luna Unscripted.